Welcome to Health Policy. Our outcomes are to identify factors that influence development of healthcare policy, describe regulatory agencies and their function in healthcare, and describe accrediting agencies and their function in healthcare. We're going to start with developing health policies. Public healthcare policies are product of both government processes and political forces. So that means that the government processes and the political forces come together and they bring these healthcare policies. They make these healthcare policies. So it's very important that we have input on that and we have people who sit on these boards to influence these policies. Development may begin with legislatures or executive branch health agency leaders committed to solve a problem or bridge a gap in services. So that's like our access to healthcare, our Medicaid, our Medicare, our CHIP programs, our children's programs, our elderly programs, all of those programs. So sometimes it constitutes bringing problems or gaps to legislatures to bring it to their attention. Hey, a lot of them don't have transportation, and do we have something that we can do for this? Special interest groups may raise awareness and begin to lobby for a policy. To be determined, the healthcare policies are to be determined before first draft of a bill is constructed. So population of the citizens that will benefit. So these are all the things that you'll need. The population of the citizens, the cost of the benefits / ratios, stakeholders. Do you know what a stakeholder is? A stakeholder is, for example, for the school or for you, a stakeholder would be the healthcare network, the school, the community, because we're adding a service to them. So those are your stakeholders. Availability of scientific evidence supporting the policy and similar process and models. We have to have evidence in order to make these policies and these bills. Major stages in policy making, we're going to start with the agenda setting. So that's like, what do we want? What are we doing? What your government response is next. So this is how we're going to deal with this type of issue. There were a lot of policies made about COVID-19, right? What was our first thing? We had to set an agenda. We got a problem here. We need to fix it. So then they just came up with a plan. The agenda setting is one of the largest pieces of this problem. So what we're going to do is we're going to agenda set. Okay, this is what we're going to do, and this is what we plan to do. And then the government response. Okay, how we're going to respond. This is what our plan is. Like, this is our plan. And then the implementation. So that's when we're going to implement the, like with COVID-19, everybody has to wear masks. Do you see what I mean? Evaluation. Are the masks working? We don't know. Certain masks are working in certain populations, they're not. Do you see how I mean? So like, for example, in the hospital, we might need to have that N95 because we're in close contact with patients. We need to keep each other safe. For out in public, to use a regular mask, and so you stay 6 feet apart. Do you see what I mean? So is it working? Is it not? Evaluation, and then we start again. Agenda setting, response, implementation, go. So at each stage, formal and informal relationships develop between the stakeholders. So inside the government, it's the legislatures, the bureaucrats, the presidents, governors, staffs, all the courts. Outside, it's the interested citizens, the institutions, the healthcare organizations, the professional associations, and the special interest groups. So that's us. How the resources are allocated and to whom are determined with political framework. Okay, so resources. What are a resource? Resources can be more than just money. Okay, that can be our ventilators. That can be our water supplies, our electric. Those types of things are considered resources. Processes includes influence, negotiation, bargaining, compromise. And the process is not necessarily logical or linear. Sometimes you have to go around in circles to get to what we really want and need out of these policies. So what are some of the federal agencies? So some of our federal agencies are the U.S. Department of Health and Human Services. Their principal federal health agency. That's who they are, the principal federal health agency. They have 11 operating divisions, and the administrators, they administer more grant dollars than any other of the federal agencies combined. The Occupational Safety and Health Administration, OSHA, they're tasked with ensuring health and safety in the workplace. OSHA legislation covers most private sector employers, their workers, and some of the employers that work in the public sector. Provides assistance to employers who must provide safe workplace, reduce and eliminate workplace hazards. The standards address a wide variety of hazards in industrial and healthcare workplaces. So it's in different kind of workplaces that you'll see these. You'll see OSHA. You'll see OSHA for construction, OSHA for healthcare, OSHA for all these other different agencies. State and local agencies, each state mandates its own health policies and regulations. Did you hear that? Each state mandates its own health policies and regulations, and in accordance with the federal policies and regulations, okay? Each state has a division of Department of Health and Human Services, so they all have a division. Their scope is the responsibility determined by that state. So the Health and Human Services is going to be different for each state. Generally reports to the governor as part of the executive branch, enforces regulation of county health departments, okay, enforces regulation of county health departments, may license or register hospitals, long-term care facilities, child care centers, clinical laboratories, and other providers. May also be responsible for overseeing and planning construction of medical facilities and receiving complaints about facilities they regulate. They often are responsible for tracking state health data and statistics, maintaining birth and death, marriage and divorce records, and enforcing other state laws. So another state agency is your Board of Nursing. So that's your licensure. And each state is also going to be different. We do have to take the NCLEX, which is across the board. However, the requirements to maintain your license and stuff might be different in each state. States' offices also, they have their EMS, and they're responsible for EMS. Establishing training and certificates for EMS personnel, accrediting training programs, overseeing the state's trauma system, and licensing medical transportation systems. Local health departments, county and state health departments, both exist in an area and may have a division of responsibilities. County health departments might be responsible for regulating health issues and widespread effects, while the city department may be providing clinical, environmental, and health promotion and all population-based services. May oversee child care, sanitation, and food safety. May offer community-wide disease, injury prevention programs, and local social service departments typically responsible for administering Medicaid, Children's Health Insurance Program, the CHIP program, women, infants, and children, so WIC supplemental nutrition programs. So these are all under your state and local agencies. So now we're going big. International health agencies, there's multilateral agencies, part of the United Nations, so that's the WHO, is the only international health organization with legal authority. So they have legal authority, and they're the only one that has legal authority. Bilateral organizations, so for example, the U.S. Agency for International Development, non-governmental, so Project Hope is one of those, and they're independent of any government and maybe faith-based. These kind of, the non-governmental ones usually do some like medical supplies, volunteers, training, and disaster response. I think Red Cross is part of the non-governmental organizations. Accreditation is the process of gaining recognition through peer review process. The evaluates quality of an organization based on standards, criteria of the accrediting, and a criteria of the accrediting organization. We have to be reputable in accrediting and establish standards using evidence-based process. Accreditation is voluntary and private, and achieving accreditation certifies that the organization meets the quality criteria and competent to provide offered services and programs. There's periodic reevaluation. We must display continuous evaluation of its own performance, act to correct deficiencies, improve performances, and continue to meet accreditation standards. And they usually do an on-site to validate organization self-assessment and performance. So that's like our program is accredited, so we have to follow these accreditation practices as well. You guys will hear a lot about the Joint Commission. It's an independent nonprofit organization that accredits our hospitals, so sets standards for accredits healthcare and provides organizations with sets the standards for them. So, and accredits the ambulatory care centers, behavioral health hospitals, and long-term care facilities. Accreditation by the Joint Commission enhances the consumer trust and respectability, provides credibility with private third-party payers, and helps organizations meet qualifications for Medicare, Medicaid, and reimbursement. So you see how that's all kind of wound in together? So if you have accreditation by the Joint Commission, you're more likely to get paid, you're more likely to be trusted, and you're more likely to have more benefits and qualifications to meet reimbursements. So influences national quality and safety standards, advancement of healthcare policies. So they go by the National Patient Safety Goals and the Sentinel Event Reporting System. So that's part of the Joint Commission. The nurse's role in the Joint Committee accreditation is helping to develop, revise, or facilitate current evidence-based policies and procedures, participating in organization review activities, and taking part in the meetings of accreditation and survey teams. That's all. Thank you for listening.